Did you know that up to 70% of travelers experience digestive issues abroad? Do you know how to protect yourself from it?
You're listening to Via Sana, a travel medicine podcast brought to you by AMSA IMU University with Professor Gerard Flaherty.
Join us as we explore what travel medicine is all about, how you can protect your health while traveling, and the exciting career opportunities in safeguarding travelers.
Welcome back to the fifth and final episode of Via Sana, where we talk about all things travel medicine. I'm Adeline.
And I'm Austin.
Last week, we tackled the wild side of travel, from bug bites to emergency clinics. But what about when you're finally home?
That's right. If you're a traveler who's just returned from a trip, then this episode is definitely for you.
And to help us unpack this, we have two fantastic guests joining us today. First off, our familiar expert, Prof Gerard Flaherty.
And our new guest joining us in today is Professor James Koh Kwee Choy, who is the Deputy Dean for Clinical Sciences in IMU University. And before we start, we would just like to say thank you to the both of you to joining us in the last episode of the podcast.
Well, since we're talking about the returning traveler, let's start with the basics. Prof Gerard, why should returning travelers even consider a health check?
Well, it's possible that they may have acquired an infectious disease abroad during their travels, and the symptoms may not manifest until they return home. The incubation periods vary for different microbes, so they may be okay when they get on the airplane, but they may develop illness when they return, and there may not be great local familiarity, especially if they're returning from the tropics, to perhaps where I'm from in Ireland, and there may not be a lot of local familiarity with some of the more exotic tropical diseases, and diagnosis can be delayed, but also some conditions, some infections, it's possible for onward transmission to occur from that traveller to family members and friends, and so there may sometimes be public health implications for certain really infectious and serious infections indeed. So I think for that reason, in some cases, screening is appropriate, but at least alert the traveller to the possibility of a travel-related illness occurring after they return home.
Yes, precisely. So even if they feel perfectly fine, it's still recommended that everyone gets screening?
No, it's not recommended that everybody gets screened. In fact, but there is variation in practice around this, so it's okay to suggest it. But the travel medicine community would generally agree that healthy short-term travelers whose exposure history has not been so significant that you're worried that they may have picked up a particular infection, they don't have to be routinely screened. Really, the cost-benefit ratio for that would not be in favor of screening. It probably would create a lot of very anxious return travelers. The yield will be very low. Some of these conditions are rare, and when somebody doesn't have symptoms, the false positive rate is likely to be very high. So longer term travelers, certain types of long-term travelers, the adventure traveler, expatriates, humanitarian aid workers, military, that kind of thing, that kind of traveler, it may be reasonable to routinely screen them even if they have no symptoms.
Okay. Well then, who exactly? So you just now you mentioned like all the travelers that needs the ones that need to be screened the most. So who exactly needs post-travel screening the most, and when is the best time for them to do so?
Do you want to take that one, James? Or
Well, I think Prof Gerard has already mentioned people who really depends on two things. One, where they have been to, and what have they been doing in the countries that they have been to. So, like what Gerard earlier said, people such as people who are returning from certain countries, tropics especially, malaria endemic countries, people who have gone into doing adventurous stuff like hiking, swimming in lakes, doing all kinds of things out there in the jungle, people who either didn't or forgot to take their prophylaxis against malaria, and anyone actually who has any symptoms particularly when they come back with feeling feverish or having a rash, coughing, or having some GI symptoms. I think these people should really get checked immediately, if possible, when they return from travel. But I agree that not everyone needs to be screened or checked.
Thank you. Thank you for mentioning about different geographical trends, Dr. James. So let's say I've just returned from Southeast Asia, where dengue is endemic, or even
Yeah.
Africa, where malaria is endemic. So, Prof. James, could you tell us more about how regional trends might influence screening priorities?
Yeah. I think we really need to know. I think as a traveler, it will be a responsibility of the traveler, and if they're not knowledgeable, responsibility of the physician in the pre-travel advice to explain to them what are the endemic diseases or infections in the countries that they go to. I often get this from our own IMU students who go for electives in different parts of the world. And they ask, what vaccine should I take? When should I take them? What prophylaxis should I take? I think that's really good questions. But for travelers who have not done that, I think getting the story from them and knowing what they did in these countries are very important clues for us to sort of pinpoint what are the possibilities. Like you mentioned, dengue in Southeast Asia, in fact, dengue, typhoid, all kinds of GI infections. If you've been to sub-Saharan, then probably you have to think of things like malaria, and leishmaniasis, things like that. I think knowing where they go and what they did again is very, very important in helping us to sort of figure out what could be the problem.
Right. So now imagine a traveler who's just returned home and has decided to get a health check. And let's dive into one of the most important parts of the medical evaluation after travel, which is obviously the travel history. So,
Yeah.
Prof Gerard, why is travel history so important, and how does it guide your doctor in deciding which questions to ask specifically?
Yeah, I think James has addressed that very well already. And the key thing is to take a travel history, because again, if the practitioner is not trained in travel medicine, they may not be aware of the importance of taking a travel history. So you really do need to find out, where the traveler was, what activities they undertook, particularly more high risk activities, including the ones James mentioned. I mean, were they walking barefoot on, outside where they could have come in contact with human feces in the soil? Some elements will be transmitted through that. And the traveler may not recall these exposures very well. So I always tell them in the pre-travel clinic that if you do something unexpected, make a note that day so we see what date you did this or that, and that might help actually then to piece the clues together. And if other members of the traveling party also got sick, that's a helpful clue. And if a rash appeared during travel, it could be very useful to capture that, because the rash of dengue, which was mentioned, it tends to come and go with the fever. So, it's important. The traveler may not remember exactly where it was distributed. People are very unreliable witnesses, even to their own illnesses, right, James? So
Yeah.
it's important. It's important that they record this somehow, and
Yeah.
I think that's very important. You want to add something, James?
Yeah, I think we should encourage all travelers to keep a travel journal.
Yeah,
Well,
good
Bali,
idea.
I have this Bali belly, they said earlier in my travel, and it definitely went into my journal about how I felt. I think other than what Gerard has said, I think there are more sensitive things we could also ask in the history, such as, did they have any sexual activities while they were abroad?
Yeah,
Um,
absolutely.
some get a bit more, daring during travels. So they might get a tattoo or something,
Yeah, for
from
sure.
parlors that may not be may not have the best hygienic practices. So these things are very important as well to help us determine what could be the issue.
Very important. And Africa was mentioned earlier, but it's not confined to Africa, but the burden is high in Africa. We advise travelers not to swim or bathe in
Yeah.
fresh water, so lakes, rivers, canals. I mean, I always joke with my travelers. I said, better not to swim or bathe in lakes or rivers in Africa anyway, because of the large wild mammals, the
Yeah.
crocodiles and hippopotamuses. But I said the ones we're really worried about in that context are actually really invisible to them, and these would be the schistosoma trematodes,
Yes.
which are flatworms. And
Yes.
of course,
Yes.
it's so easy to get infected with these or infested, since
Yeah.
they're. But again, all of this will really help in determining the investigations to be undertaken, so that you don't just complete a big panel of investigations without focusing on the most likely diagnoses. And that saves the
Mm.
health service money, it saves the patient time. It's much better if you can make a diagnosis with fewer
Yeah. Yeah.
investigations.
Yeah.
Yeah.
Talking about animals, I think we also need to highlight, nowadays it's quite popular to go and pet this animal and that animal, right?
Yeah.
I think I mentioned earlier in another talk that say that the only thing that I would actually pet is a stuffed animal. But yeah, if you have
Wise man.
actually, activities including petting deers and other animals, so there are a lot of tick-borne and
Ticks.
uh,
Yeah.
tick-borne diseases
Yes,
that
I
one
had
may
a
acquire
traveler
from such
just
activities.
recently. I had a traveler, as you mentioned, ticks, going to well, all throughout Asia, but spending some time in Mongolia.
Ah,
And we were just considering tick-borne encephalitis because it is the season for it there.
right.
But I'd been to Mongolia, and you certainly can avoid tall grass. I mean, for the most part, the grass actually very short in the steppes. And so I said, well, don't be rolling around in grass. But I said, the ticks, they transfer from usually reasonably
That's
tall
true.
grass onto the
Yeah,
skin. And
yeah.
obviously, wear long trousers and tuck the
Mm,
trousers end into your socks, and then check each other's skin for ticks. It can be a nice ritual at the end of a day. But it is important to mention these in Africa. A really painful bite from something could be a tsetse fly bite,
that's
and that
true.
might prompt a search for
Sleeping disease.
African trypanosomiasis, sleeping sickness. Yeah, yeah.
All right, doctors, thank you for sharing all these wonderful experiences that you all had. So moving on, let's talk about some of the common syndromes travelers might face after returning home.
Yeah, so things like just now you mentioned fever, rash,
Yeah.
irritable bowel syndrome, even reactive arthritis. So generally speaking, when do these symptoms usually appear after traveling?
Gerard,
Well,
maybe you can take that. Yeah.
oh, okay, I'll start off. Yeah, I mean, it depends on what the cause is. And in some cases, we can't find a cause. Maybe 25% of
Mm,
cases of fever in return travelers, no cause is found. So it's just a fleeting illness. Um, I think fever has to be taken very seriously in the return traveler. That's something we would all be very aware of in travel medicine. If the traveler has visited a malaria endemic country, even as James has said, if they've taken their prophylaxis correctly, people are often late with doses or they miss a dose and forget about it. So they may think they've taken it correctly, may not have. But of course, there's always a chance of breakthrough malaria, if the burden is high enough. And then the prophylaxis may or may not have been appropriate for that region as well. There could be some
true.
local resistance to antimalarials. So I think fever we take very seriously. And, this could present on the airplane. I always say to travelers as well, don't keep it quiet on the airplane. And we always think of malaria, and really that has to be ruled out because of the risk of really rapid progression, especially in the case of high parasite load and cerebral malaria. So we certainly don't sit on that. And James mentioned earlier about telling the traveller this in the consultation before they travel. That is the key. They need to know this before they go, because
Yeah.
it may take them some time to gather themselves. And remember, when you're ill and you're perhaps jet lagged, having returned home, you might be just less likely to look after things like this, and you might attribute even symptoms to jet lag. So, but the traveller must be keenly aware that malaria has to be ruled out, and that involves a visit to the local hospital. It's not something that they can. I mean, rapid diagnostic tests for self-diagnosis of malaria, they're not appropriate in this instance. Now, really, you
Yes.
need to be seen by a physician. So, fever, that could present very quickly. A rash could present quickly. Depends on the incubation period of the organism. Dengue might be 2 weeks around that. So it depends when they were exposed. So I tell the traveller, be alert to illness on board the flight and as soon as you arrive home. And really for up to, well, some people say 6 months. I mean, in the case of some of the worms, the helminths, perhaps you can have a more prolonged incubation or illness. But in the case of certain parasites, it can take longer to show symptoms, or the symptoms may not be that severe. But it just depends on the severity of the illness. In some cases, the illness could present within the first few days, and the patient could be acutely unwell. In that case, they're highly likely to alert medical services anyway. If the symptoms are more indolent and sort of low grade, perhaps in the case of some gastrointestinal symptoms, some bloating, mild abdominal pain, intermittent diarrhea, the traveler might neglect that for some time,
Yeah.
and that could lead to delayed diagnosis.
That's true.
Okay. Okay, so next question. So just as importantly, when should someone be worried enough to seek urgent care for that condition?
Yeah, I think when any symptoms that the traveler has on returning home persist, I think that's a red flag. You get GI bloating or nausea, diarrhea, even a rash, and then development of new symptoms like sudden yellowing of the eye. I think that's malaria, developing shortness of breath, worsening rash or bleeding disorders. I think these are all red flags that we need to look out for. And if they persist, I think that those are all red flags that we really it's just telling a person that he needs to be seen by a doctor and evaluated for any kinds of infections that may have developed from the travel. That said, we like to self-medicate. I confess to that as well. And sometimes, when we take, I think Panadol is one of those things that we can easily get anywhere. And then if you feel unwell while we're traveling, we could take Panadol or paracetamol. And although it does help alleviate the symptoms, it could mask some serious symptoms which may delay diagnosis. So self-medicating, some of us carry antibiotics and taking it inappropriately, that may also cause a delay in diagnosis as well. I think this needs to be made aware to any travelers as well.
Thank you for bringing that up. Actually, we wanted to touch on this topic of the dangers of self-medication.
Yeah, I think that's a very important topic.
Actually, the Institute for Health System Research in Malaysia actually estimated between like 62.7 to 80.9% of Malaysians, adults in Selangor, actually reported practicing self-medication. So like you mentioned just now.
Good company, James.
Well, Malaysians.
It's the same the world over.
Like you mentioned just now, paracetamol and even antibiotics.
I think paracetamol is fine. I think, but antibiotics would be a totally different scenario because, even my mom used to do it. We sort of keep, leftover antibiotics in the fridge for just in case, in case something similar turns up, and my mom would say, "But take this, it helped the last time," and just take it. We don't even know what we are taking, and we don't know what antibiotic is being given. And I think inadequate treatment as well as inadequate dosage or duration of therapy, all eventually will lead up to giving rise to the problem of resistant bacteria, right? These bacteria that we have will grow immune to the antibiotics, and then when they return from the travel, it becomes a bit of a dilemma. The treating physician will have to figure out what would be an effective antibiotic because the traveler will have taken several antibiotics on the way. I remember going to a South Asian country for travel, and you can buy it over the counter, and they have this 5-in-1 antibiotic combination. I thought that's amazing. It's like a 5-in-1. You hardly ever hear such things, but you can get it over the counter easily. And then you come back and you're sick, and then we're running out of idea what to give them.
Yeah, I remember being in Nepal trekking and one visit years ago, and there was a pharmacy in one of the little villages, and remember these are at high altitude now.
Yes.
So at this stage we were well over, we were probably 4,000 meters or so. And little villages have a little pharmacy there, and a lot of the medications were out of date. But
Oh,
I remember they're selling antibiotics freely and albendazole. I was just surprised that they were so well stocked. But it's just, it's not really the appropriate environment to be dispensing antibiotics over the counter. But many trekkers then just very, very happy to pay, and it was very cheap as well. And they were self-treating en masse, which in a high altitude wilderness environment is really not recommended. They could be, getting higher and higher, and then getting sicker and sicker, getting more and more dehydrated. Then eventually that can lead to the need for a helicopter rescue or something,
yes.
something like that. Yeah.
Mm.
Okay, now let's consider this from a public health perspective. So suppose a traveler becomes ill after returning home. Why is it crucial to report certain illnesses quickly?
I think a lot of infections are mandatory for us to notify. So the earlier we can diagnose and notify the public health sector, the easier for us to control, because these infections have a potential to become outbreaks when they return. In my experience, I've seen outbreaks of MERS-CoV from pilgrims who went to perform the Hajj and come back. And if they are late in presenting themselves or the diagnosis late, they would have exposed, others around them would have been exposed to the same thing. I remember traveling back from Thailand. I was feeling very, very sick on the plane. I was wearing double mask. It was a short flight, but I was feeling very, very unwell, and I knew I had something. I caught something, and it turned out to be COVID. I think that's the latest thing. And now even the even more recent ones are the influenza, which we had early this year, and of course the mpox. So these have potential to become outbreaks in the community that has not been exposed to them. So I think early reporting, early diagnosis is very important. You need to report this year.
All right. So in addition to that, how can returning travelers help prevent spreading infectious
Yeah, I was
disease?
going to talk about that. If you are sick and you come back, I think it's a responsibility for a person to, if you have respiratory symptoms, I think it would be wise to wear a mask. Particularly if you are symptomatic, coughing away or having a lot of phlegm. I think we need to stay away from vulnerable individuals, the elderly, the very young. I think especially if we have GI symptoms, I think practice of hygiene is very important. Hand washing, I think very, very basic things, hand washing. And if I've had fever and it could be dengue or even malaria, I think again, isolate ourselves whenever possible. And we do have the vector here in Malaysia, right? And so encouraging the use of mosquito repellents may help preventing the spread to other people around us. Yeah. So there are steps that we could take as an unwell traveler to protect others while getting ourselves evaluated and treated.
Yeah, I think we can all agree how relevant this is given looking back at the recent COVID-19 pandemic. So now we'll just be shifting gears a bit to the psychological aspects after traveling. Let's talk about jet lag. Prof Gerard, can you tell us what is the science behind it?
Well, in jet lag, there's a lack of synchrony or a mismatch between the person's own internal body clock. And as you know, as medical students, this is controlled by the suprachiasmatic nuclei in the hypothalamus. And it's linked to the retina. So light affects this. And a lot of our circadian rhythms, our daily rhythms are linked to the light dark cycle. You see this very keenly in the avian kingdom as well. Birds very much depend on light to guide their behaviors. Anyway, so in the case of crossing time zones quickly, then there's no time to acclimatize to the new time zone, and therefore, if you like, your body and your brain are still back in the old time zone, and it'll take some time to catch up. And of course, this only applies to east-west transmeridian travel. North-south, that doesn't apply. Of course, you can be tired traveling north-south, but or south-north. That's just travel fatigue. But jet lag is something different, and there's various symptoms described. There is a Liverpool jet lag index, which mentions lots of different symptoms, but people often feel a bit, well, lack of interest in activities, lack of appetite. They may have some nausea. Obviously, difficulty getting to sleep, having flown east. They might be, might be difficult for them to fall off to sleep. They might be very tired in the morning, and then the opposite when they travel west. So when I return from Malaysia to Ireland, I wake very early in the morning, maybe 4 o'clock for a few mornings. And then in the evening time, I'm getting tired a little bit earlier. I may have to go to bed earlier.
Yes.
So it can be, just disruptive, but as people travel more, they get used to it. There's some evidence that people with more rigid sleeping patterns suffer more than people with more flexible sleeping patterns. But in some cases, it can affect personal safety, I think. There's not enough emphasis on this. People might travel to a country, arrive jet lagged, and then hire a car at the airport. I always recommend they don't do that. And if they're traveling home and they're jet lagged, better that somebody else drives or that they use public transport to get home.
Agreed.
Because they just may not be aware that they'll probably feel quite disoriented, and that could lead to problems with their safety. So it does take a few days. The old rule of thumb was that it took 0.75 times the number of time zones after you've flown east. So if it's 8 hours to Malaysia at certain times of the year from Ireland, you'd say you'd be fully right in 6 days. Now, it never takes me that long, but perhaps there are subtle impairments up to 6 days. I don't know. But then flying west, it's quicker. So 0.5 times the number of time zones. So you should be right after 4 days. But it will vary from person to person. And it's recommended if you don't travel for long, maybe just 2 days or less, that you anchor your body in your home time zone and don't even try to acclimatize to the new time zone.
And at the same time, I think you can also avoid coffee, any kind of stimulants. I think that helps, and try to follow though for travelers that are more than 2 or 3 days, I think once you need to acclimatize, try to get as much sunlight as possible, so they try to force reset your body to the new time zone, getting the sunlight. Don't sleep in until it's 2 p.m. and then you get up. Everybody's already up for 6 hours. I think that helps as well.
The sunlight is interesting because there are apps available, and they're a little complicated, but you can carefully, once you put in your flight times, you can get a detailed guidance on when to expose yourself to light. And even not to wear sunglasses certain times, but other times I recommend you don't seek light between these hours. So if you follow these apps, I mean, they're a little complex. I'm not sure how useful they are in practice. Some people, of course, take melatonin. But this isn't licensed for the prevention of jet lag or the management of it, and it's not even available in certain countries. It may be available for short-term treatment of insomnia, for example, and it's not regulated. So even in the United States, it's available as a food supplement. It's not regulated by the FDA. And you can purchase it, for example, in Ireland. So when I get melatonin, I get it in different jurisdictions. But there is a Cochrane review on it, so we do know what dose might be effective. But there's varying doses used out there, and people are probably using them incorrectly.
And some people use it and they don't find it helpful. Well, whereas others have used it and
Correct.
Immensely useful.
Okay, so beyond having to adapt to our biological rhythms, traveling also makes us adapt to local traditions and lifestyles. So many travelers experience culture shock. So, Prof. James, could you tell us exactly what is culture shock?
I really want to talk about that because I just came back from spending 8 days in Flores, and it was like a paradise there. And I reached home last night at around 9 p.m. and I had to take a train to the next station, and then from there get my car, which has been parked there for 8 days, covered in dust. And I just found myself getting so angry at everything. I don't know why. I was just angry. I was like, why is it so noisy? Why there's so many people? Why is this? Why is that? And uh, I was just being very, very irritable. And then, my GPS stopped working, and I couldn't find my house key when I got back. It was just horrible. And I realized, that it's just something that uh, I've come from a place where I was quite happy over there, and then I've come over. It's actually nice to be home, but I was just so irritable, and there's something called a reverse culture shock. I think it's a kind of disorientation coming home, and feeling really depressed. I'm a bit depressed at the moment, yeah, because this morning the sky wasn't blue, and yeah,
But you have the post-travel blues, James.
yeah, and my irritability is gone. I mean, I had a bit of anxiety, but it's gone now. But I'm just a bit of depressed. I think some people experience that, especially if you've been away for a significant number of days or time. I think that really, if you've just gone for a day, I don't think it's gonna happen. But I've been away for more than a week, and I really found myself very irritable yesterday.
Yeah, I think what you describe is more common than people would choose
Yes,
to admit, and you're very honest about that. And in one way, I think we can anticipate this before travel. So in the clinic, if somebody's traveling for a
that's true.
while, we should probably tell them, well, it will feel very different when you come back. You may
Yeah.
long for where you've just left.
Mm.
You may start to even sort of question the life you have in the country you have. Especially, for example, if somebody's going to a country and there's different freedoms there, different laws,
Yeah,
and so on. They might feel that that's a paradise for them, utopia,
that's true.
and then they feel dissatisfied with their own country. It'll be a gradual transition, and as long as they're not too hard on themselves and have good support in the first days or weeks after they return home. But this is very important for people who've gone to a country that's maybe very impoverished or war torn, or
Mm.
where they had some very unpleasant experience. People who maybe were the victim of a mugging or worse, sexual assault
Yeah,
during travel. I mean, they may not have confided in anybody. We should
yeah.
encourage our travelers, if something really happened to you that was bad and you're worried about during travel, tell somebody. And in some of these cases,
Yes.
you'll have to report a crime, and you might even need counseling in more severe cases where you've
Mm.
really witnessed something disastrous.
Mm.
Yeah, first of all, Dr. Prof James, yeah, so sorry to hear about your
So,
recent experiences
but
from your
I'm,
recent
I'm, I'm
travel.
getting over it. I'm glad there's a weekend ahead so I can recover fully.
Absolutely. Good timing.
Hopefully.
Yes, that's true.
Okay, but now let's have the final advice from our guests. If you could give just one piece of advice to travelers after coming home, what would it be?
Well, okay, maybe I'll just go first. I think you need to listen to your body. Um, if you feel off, you feel unwell, um, even if it's a couple of weeks down the road, I think you need to be aware of that, and maybe seek medical attention. Yeah. If your body says you're not well, I think you need to listen to that.
Yeah.
Yes,
I can't
Gerard,
improve
maybe you
upon
can give us.
well, I can't improve upon that advice. I mean, maybe just to advise the traveler to be very alert to fever. Do not
Oh,
ignore
yes.
fever. If they've been to a malaria endemic country, but
Mm,
even if it's not malaria endemic, I think I would extend it beyond that, because,
true.
countries have maybe eradicated malaria, but there's always a risk that you get airport malaria or various different things along the way. And remember, the traveler could be a sentinel for a new outbreak. The International Society of Travel Medicine has close collaboration with the GeoSentinel, which is the research and surveillance network, and it's global in its reach. And all of the cases that people who see returned travelers are recorded, and alerts go out when we see, multiple cases or some unusual infection from a particular area. So I think in travel medicine, James will know this well, you have to be very alert to these infectious disease outbreaks.
Yes.
They're changing all the time, very dynamic. And
Mm,
then in some cases, when you see a traveler who's ill, then you think, oh, I know there's an outbreak in that particular area. I need to check for that.
Yeah.
And so that's one of the joys of travel medicine. This podcast series has given people a nice flavor of travel health.
Yes.
But one of the great joys is you have to keep up. It's changing all the time as
That's
conditions change and as new infections emerge.
Yeah.
So thank you so much to Prof Gerald and Prof James.
It's been a
This-
pleasure.
It's been such a pleasure having you
Likewise.
on our final episode of the series.
And to our listeners, thanks for joining us on this interesting journey. We hope we all stay healthy wherever you are. Until next time.
Bon voyage, everybody.
If you liked this episode, hit the like button and share it with your friends.
For more updates, find us on YouTube, Instagram, or Spotify.
If you have any questions, do put them in the comment box below or DM us on Instagram.
Until then, this is the Via Sana team signing off.